see so many clients come in that have made investments that they wish they didn't or they don't totally understand. And so Kathy and I feel really strongly that education is the key.
Welcome to Money Talk with Terry and Kathy, brought to you by the Spectrum Financial Group, serving individual investors and retirees. Welcome back to Money Talk. David Wolf here, as always, with Terry Huber. And our special guest joining us on this edition is Kathy Ferguson. She is 25 years experienced as a medical auditor, a medical billing specialist, and medical bill collector. She's run the gamut on her experience base around all things medical billing. Welcome to the program, Kathy.
Thank you, David.
It's great to have you with us. Terry and I are anxious to learn more. She knows more than I do, and I'm like our listeners. I'm learning what comes up with medical billing, what we need to know about, and how you help people in your business, medical debt resolutions, solve those problems. So, starting at the top, you have said that you have a 5-step program to help people prevent surprise medical billing events. How does this work?
I educate consumers 5 steps on how to prevent surprise medical bills.
All right, so there are 5 steps. Can we go through the 5 steps maybe to walk through them and get a feel for how this looks?
Okay, I let patients know, consumers know, that they need to emphasize their patient healthcare information rights. It's called PA. Mm-hmm. Always get answers to your questions from the healthcare professionals. That is the staff and the doctors.
So I'm going to unpack each of these as we do them, and if you don't mind. So the questions we would have, these are while we're actually being seen by a practitioner. Is that the way to think about it? In other words, ask whatever you're thinking about with respect to the coverage, billing, the full spectrum of what I'm getting at is what should we ask, I guess. What are some of the things we might think to ask?
Write down your questions. Why are you going to the doctor? Why are you going? What is the purpose of the visit? Right. If it's a routine visit, you make the appointment for a routine visit. Mm-hmm. And when you are with that provider, you stick strictly to the routine. When the doctor is asking questions, well, how's your blood pressure? Do you need refills? Stick to the routine, because that takes it out of routine once you have said yes. It is no longer a routine visit. And that's when your healthcare insurance company pays 100% for your yearly physical.
I see. So it needs to comply with what they call a routine visit.
Yes.
So you want to make sure you stay with the program, so to speak.
Yes. And if you have other concerns, you make 2 doctor appointments.
Okay. And you do
one for physical, one for your other concerns.
Okay. So they're separate billing events, right?
Absolutely.
Right, cool.
So, Kathy, I was just wondering, how do you know that that's routine? How would you know that?
By the codes, diagnosis, procedure codes. I always ask the client, I give a 1-hour complimentary consultation to get the history. What was your appointment? What did you say when you made that appointment? Were you answers when you were in there? Well,
for the patient, how do you know? I mean, you have to prepare yourself before you go to the doctor to know what is routine, correct? I mean,
well, you need to be familiar with your healthcare policy. Your yearly physical, that is your routine.
Okay, so be familiar with what your insurance is designed and engineered to cover in terms of routine visits, and make sure when you're at your program, when you're at your appointment, to stay within the parameters of what we call, by definition, a routine visit.
Absolutely.
Okay, great.
Absolutely.
Now, point number 2, at every healthcare appointment, always ask for a copy of the itemized bill before leaving the office. So unpack this for us a little bit, and put it into sort of perspective in real life for us, if you can.
As your conversation with your provider and whoever else is in the room, they are making notes. They are checking off why you're there, your concerns. They are your healthcare provider, and they are there, and they want to take good care of you properly. Mm-hmm. And I say, Lee, ask for a copy of the itemized bill before you leave, because they're there checking off.
And you say here in the notes, and folks, we're looking at some notes here around the 5 steps. when you see any non-covered charges that you're billed, call your insurance and provider and ask why it occurred.
Exactly, because 9 times out of 10, I find a coding error.
Really?
Diagnosis or a procedure code error.
Did you say 9 times out of 10?
Yes, quite a bit.
You see,
I'm probably
right.
stretching it a little bit
That's all
there.
right. Well, for impact on our program, we want people to know that they should be looking at these bills. We've done a lot of work around, people who don't. We've talked about people not opening their financial statements when they come monthly because they're afraid of what they're going to see. This is probably in that same
Absolutely.
category where
It is.
you just don't want to do it.
It's fearful. That's why I try to emphasize to prevent surprises with medical bills because they are high dollar. They can be very expensive.
Okay.
And the other thing is, a lot of people do not understand those statements.
Exactly,
They're written
they
in a
don't.
way that you can't understand what it's telling
Exactly.
you. Right?
Exactly.
And they do that on purpose, I believe.
Yes, and it's very time consuming, and we're always so stressed with our daily lives.
Right. So it's just hard to take time and be present with your bill. It's not particularly sexy work. I mean, you're doing the work that many of us don't want to do for ourselves, and you're really serving your customer so beautifully. And we'll talk more about, the ins and outs and the way you engage with your clients after we get through the 5 points here. We're visiting with Kathy Ferguson, an expert in medical billing. Her company, Medical Debt Resolutions, the website, one and the same, medicaldebtresolutions.com. Number 3 is always carry your current health insurance card. So keep the card with you and pay only the amounts listed on your cards. So anything we should watch out what's beyond this piece of paper we're reading from today?
Yes, I've had a client say my office visit was $30. And when I was at the provider's office, I was told, it's changed to $50. Your copay is now $50. And he said, but my card says, and she said, well, the insurance changed. Well, that's not true. The insurance policies change once a year. They don't change the prices
Mid-year.
consistently.
Yeah.
Right.
Now, in that instance, this has actually happened to me at the ophthalmologist. If it happens, is there a chance that you just didn't get your updated card yet? And is that an issue at all? I mean, in other words, it's a 1-year cycle, but how do you handle that?
What you would do is immediately while you're in that office, you call your healthcare provider right then and there and ask.
Love it. Okay. This is great
Cover
advice.
yourself.
Great advice.
Protect yourself.
The next one, number 4, your healthcare insurance companies all have social workers and case managers. You should have one person ask all your concerns to. So always have this person's name, phone number, and email address with you. All concerns really funnel through this one person.
Right. So there's consistency. You're not getting different answers with different people. And you can always ask your health insurance company for a caseworker for yourself and your family. And I'll have just one caseworker for the whole family. And that is your contact person. And so when you're at the office, call that caseworker and say, my copay is $30 and now they're telling me $50. Why?
Right.
Please explain.
You've got to be curious.
Detailed.
You're really, really curious. That's part of what makes you good at what you do, about the details and about people's money and protecting them. There are you mentioned this offline, there are 10,000 health insurance companies across the country. Do they all have this setup where you have potentially a social worker or a case manager that can be assigned to you? Is that a structure that I guess it is.
I believe so. Yes.
Yeah.
Yes.
Because I haven't encountered that myself. Of course, I just changed. But how about
neither
you,
have I. Really, I honestly didn't know that.
You could ask for someone to be your person.
Yeah.
Right.
So I need a caseworker that is my and my family's caseworker now till the end of time.
Okay. All right. So it's a lifetime sort of,
Yes.
I won't say advocate, but they're your point of contact.
Right. And they can help explain things about your policy that you are not understanding.
Okay. Excellent.
And the healthcare providers, the professionals in the office, they deal with so many different health plans. And especially in New Mexico, we have got, a lot. And the Affordable Care Act is just crazy.
Okay.
And confusion is so easy. And we're human. We make mistakes. We're not perfect.
Right.
And I know a lot of the billing errors come from coding errors.
Yes.
So things are just coded improperly. And so can your
A lot of
case
times.
manager help you with the coding situation? I mean, if something's been coded improperly, will the provider fix it or they won't fix it?
They will fix it.
They will?
They will. It needs to be brought to their attention. And, you get your EOB, your explanation of benefits, or it's called RA, remittance advice, from your health insurance company. Every time you go to the doctor, they submit the claim to the health insurance company for their payment. And you get a copy showing what
How
the
they
data
coded it,
service,
yeah.
what you were there for, the charges, individual listed charges, and there may be non-covered charges. And you call this caseworker and say, explain this non-covered charge on my EOB.
Yeah.
What is this for? Always ask. You've got to ask questions, constantly ask questions, and be on top of it. This prevents surprise medical bills.
And as you say that, Kathy, what also comes to mind is just the experience in the medical system altogether can be very intimidating in a world where we've been conditioned socially and otherwise to sort of bow down to the authority of the medicine professionals,
Yes,
the medical
yes.
professionals.
Well,
And
it's respect.
understood. And there's this balance between reasonably curious about what you're going to spend and any questions you have regarding your medical care, including, of course, your world, which is the billing part. But I guess my point is that the conditioning that we've had with the medical treatment itself and sort of feeling intimidated by the experts and the surgeons and the specialists almost spills over into the billing side of it from an emotional perspective. And that's part of where you fit in as being their advocate, isn't it?
Yes, and they want to help. Like I said, we make mistakes, and they're excited that you have that interest in knowing, wanting to know.
Okay.
And that just keeps things better financially for you.
Perfect. I'll move to number 5, which says, when you're referred to another doctor, facility, lab, x-ray, etc., immediately call your insurance company and ask if that referral is in or out of network. So let's stop there. Talk to us about in and out of networks and what this all means. Decode this for us, right? Oh, gosh, I've just been spinning in this for years.
We have lovely health insurance companies across the country, but New Mexico...
That's capital L.
New Mexico, and I don't know who else does at the moment, but we have the in-network, out-of-network PPO plans.
Okay. Those are the 3.
Those are, and I'm kind of treading some water here, most likely, with my terms, but
All right.
in-network is contracted agreement with your health insurance company to be their provider.
Okay.
Work with them,
Okay.
accept their requirements, and out-of-network is you go to someone else.
Someone who's not on that list of
Yes,
approved,
it's not on in your policy. And out-of-network will always cost you more money.
Well, that makes sense. What are the occasions where you might have to go out of network from your experience?
Possibly a specialist.
Mm-hmm. Yeah.
A form of habit with the providers. They use a certain lab, a certain x-ray company. Mm-hmm. And, they deal with an awful lot of different health insurance companies, and they may make an error sending you to an out-of-network. And that's why I say you call right then and there while you're in that office. Call your caseworker, call the insurance company, and say, I am now being referred to. Is this in or out of network, and what will my cost be? And you'll get an answer.
Okay.
Because, Kathy, what happens when a person goes to an out-of-network provider? The out-of-network provider doesn't tell them they're out-of-network.
Yeah, surprise.
Right? And
Yeah.
then they're stuck with that out-of-network
That's
payment.
right, they are.
But whose responsibility is it to tell them they're out-of-network? Is it the consumer or the provider?
It's both. The consumer needs to look after themselves because the provider can't.
They're not always going to tell you.
They see an awful lot of patients. They've got quite a staff there doing a lot of things.
Mm-hmm.
So I do think
you've
people
got to protect
assume
yourself.
that
Right,
the
always assumptions.
provider
Yes.
is going to tell them
Yes.
if they're out of network, and they don't.
Yeah, and they'll, and then the provider will say later, well, I thought, and that costs the patient more money.
Yeah, because you do. You think they're going to let you know if you're out of network, and they don't.
They may not. They may not. So don't rely on the provider to provide that information or volunteer it. They're dealing with a lot of cases.
Right. And months ago, there was an article in the Albuquerque Journal from the superintendent of health insurance that ER visits are now to be paid in network. In emergency, it has to be an emergency. It can't be your third visit because you have nothing better to do.
Yeah.
And, abuse the emergency departments.
Right. I've heard of this before.
Yes. And they are paid in network if it is an emergency. It doesn't matter where you go.
Okay.
Doesn't matter.
Okay.
Because it's an emergency.
I see. So even if that emergency facility is out of network for you in terms of your relationship to your insurance provider, it will be billed at an in-network rate. Is that?
Yes, it has to be, coded as an emergency, and you cannot abuse, as a consumer, you cannot abuse the emergency
This
departments.
came up in the news recently,
Yes.
I think, with the abuse piece.
Yes.
Yeah, I think I saw that. There is a bonus number 6 here. Always look for non-covered charges. We really kind of covered this already. Ask your health provider if everything's coded correctly, because a lot of the errors come up there. And here's where you really fit in with your company medical debt resolutions, and that is the overwhelm factor, right? So many of us are overwhelmed.
Absolutely. It is overwhelming because it's something you don't understand.
Yes.
You're not something you see every day.
Yes.
And we have a lot of trust and respect.
Yeah, we're not educated to do this,
Yes.
and it's becoming more and more complicated.
It
That's
is,
right.
because the ICD-9 codes have changed to ICD-10, and oh my goodness, what a difference.
Well, we've spent some time, what I'll call, in the important weeds that we need to be in around all this, because it all feeds the idea that we need to be curious and ask about the weeds, ask about the details of our billing. You have some stories to share that may sort of, how shall I say, spotlight the importance of working with someone like you to help them navigate the waters of medical billing. So, if you will, I'll toss it to you.
Okay. Some of my discoveries have been, I've had a client who was pre-qualifying to buy her first home. There was an $8,000 medical bill. She knew nothing about it. It had been on there 5 years. She said, my daughter is 5 years old. This was the delivery of my daughter. And I never knew this bill was on here. And everybody was paid. I had primary and secondary insurance. And here's an $8,000 bill. So I worked with the healthcare provider, and the bill had never been filed to the insurance company, and they were billing her.
So if it's not filed, the follow-up question there is, if it's not filed, you'll be billed directly.
Yeah, but there's timely filing limits with all insurance companies, anywhere from 60 to 90 days.
Okay.
That have to be billed to them.
Okay. Is the range different because of the type of services provided, or?
The different plans.
Different plans. Okay. Yeah, we can keep it broad here. What else? Any other remarkable stories where, in cases where of overwhelm or just something that wouldn't be on our radar as far as the range of things you see?
Yes. This year, I've had a client where the spouse passed away, a cancer patient, and he said, at every visit, every treatment, in and out of the hospital, I paid my deductible and coinsurance at time of visit. Once she passed away, he got a bill for just under $43,000.
Wow.
$43,000. And he said, I just now buried my wife, and am I going to lose my home? I don't have $43,000. And so I ran an audit, and he was being billed 100% of every cancer drug at her final inpatient hospital.
How do you explain that kind of?
It was a coding error.
Again, a coding error.
It was a coding error. The cancer drugs were coded incorrectly. And then I did further research, and the bottom line was provider wanting the life insurance policy.
Which I had never heard that before.
I had never heard of that, and
Yeah.
Yeah.
Is that a
Interesting.
possibility? Like, how can they attach that to a life
It's a
insurance?
debt. It's a debt.
So it would have to be paid
Out of the
through-
proceeds
out
of, oh, go ahead, sorry.
Yeah, out of
Yeah.
the proceeds of the life insurance.
Yes.
Yeah.
And that's what they wanted.
Yes.
That's terrible.
Yes. I've seen many different circumstances. I work them all different circumstances. And there's a lot of human error.
Wow. We need more Kathy Fergusons on
Yeah,
the line.
I have a question for you. So if you know that you're about to have a surgery that could be expensive, what's the best time to contact you? Before, after, when you get your bills? At what point can you be most helpful?
At any point, but the earlier the better. Because let's fix this in the beginning.
Right.
With educating the client, ask these questions.
Okay.
Call the caseworker, call the health insurance. Is this in or out of network? What is my cost?
Yeah, because I know Kathy will go to the doctor, to the hospital for
yes.
you.
Really?
Yes.
Yeah,
I
and-
am. Yeah.
Yeah.
I'm not a phone call person.
Kathy, how do you make money? How do you get paid for the work you do for people?
I offer a complimentary 1-hour consultation
Okay.
for you to tell me your story. I take a $500 retainer fee up front.
All right.
That covers about 6 hours of work.
All right.
And bills $10,000 and more, I take a percentage of what I have saved you.
So it's going to help.
It is. It is.
Yeah, there's so much of this. It's rampant. It really is. And I remember, Kathy, you told me, was it 85% of all medical bills are incorrect?
Yeah, 87% of Americans generate a medical bill yearly. 84% of those have errors.
That's crazy, right?
So
That's why our bankruptcies are so high.
you mentioned
in medical
the
bills.
spec on the
Yes.
trillions of dollars of bankruptcies.
Over $4 trillion,
4 trillion.
within 6 years.
In the United States.
2011 to 2017.
Okay, so that's wow. That's a huge number. Are there a lot of people in the business that you're in doing it the way you do it, or something like the way you do it?
In the state,
Well, I was
of
asking
New
more.
Mexico,
Well, I was
I'm
more
the-
broadly, but in the states, fine. Yeah.
yeah, I'm the only one that does this. There are
Wow.
other people outside and across the country. There's not a whole lot, but I never make a payment plan. Never.
Okay.
I find mistakes. I have them corrected.
Okay.
And not all bills have errors. There are bills that are fine. There are no.
Okay. So you
are.
where they're correct.
And I get my statistics from the New England Medical Journal and the Stanford Medical Journals. That's where I look for, I get information from.
Okay.
So another question, I know friends who have been in the hospital and then they don't look at their hospital bills. And I know that if it's really important to go through those bills and
Yes.
see exactly
Yes.
what you've been charged for, like how many aspirins, how many Band-Aids, and
Yeah.
what those
Yeah.
charges are. And do you find those to be out of line? I mean,
Oh, yes.
Do you find
Yes.
mostly on a hospital bill to be out of line?
Not all of them are, but there are. There's fee schedules, federal fee schedules that they're all to follow, and the insurance company makes sure that those are corrected correctly.
And I know Kathy does a great job. She's the only one in the state. And, when I do hear about people, I send them to Kathy.
Yes, she does.
Because it's important. People don't know about this. Again,
Yes.
we don't know. We have to be educated.
I'm a financial patient advocate.
That's a great way to say it.
Yes.
Financial patient advocate. We've been visiting with Kathy Ferguson. 25 years in the business. She knows everything there is to know around medical billing and the process and the errors that occur, and there are many. Her website is medicaldebtresolutions.com, and you can also reach her in New Mexico at 505-307-9350. She's the only one in the state, guys, so give her a call if you've got questions. Stay curious. Any final words from
Oh,
you?
thank you. Thank you, David and Terry. I appreciate this opportunity.
You are welcome.
Yeah, thank you for coming because you've got good information for
yes.
us. So.
Thank you so much. And any final words of wisdom, other than we should ask a lot of questions?
Call me. Let me help you. Don't pay the bill.
Excellent. Thanks so much. Thanks for listening to Money Talk, brought to you by the Spectrum Financial Group, serving individual investors and retirees. Find out more at sfgnm.com. Investing in securities involves risk of loss to both profit and initial investment. No investment process is free of risk, and no strategy can guarantee returns. Discuss with an investment professional the unique risk-return profile of an investment strategy. Past performance is not indicative of future results. Registration with the SEC or a state licensing agency does not imply a certain level of skill or training.